The question is, what are the risks of traveling 8,000 miles to, say, South Africa or down to Costa Rica and having cosmetic surgery, and is it a good deal? Well, dollars and cents wise, it is a good deal, but remember, you have to factor in the airfare and all those other issues. But let's just say that the total expenditure is less, and it may well be. It's not the craziest thing in the world, frankly, for some people. And by for some people, I mean those who are a little more adventuresome. Here's why. First of all, you do combine it with a vacation, but you better take the vacation part of it first because you don't want to be bouncing around in a safari truck after you've had your tummy tuck. But secondly, the real issue is what if there's a problem? And who presides over the postoperative care? Because, you know, the care of the patient doesn't end at the end of the operation or even a week or 10 days later. After all, there's wounds that have to mature. Sometimes they heal better in one person than another, and who's going to preside over that? So the issue is who's going to give the postoperative care. At best, that's the best scenario problem. But the worst scenario problem is, what if I get a complication or an infection, and now I'm 3,000 miles or 10,000 miles away from home? It's costing me X amount of money because my health insurance doesn't even cover this medical problem that I have because I'm in a foreign country. I don't have any family here. Is that likely? Most of the time not, frankly. I will tell you the South African surgeons are very good. We've seen excellent work coming up from Costa Rica, but we've also seen very substandard work coming up from Costa Rica. For example, like, say, I could tell you the same thing about Mexico. I could tell you that I've seen people come back who've had very nice work done, and we have other people that walked into this office without an appointment, having a massive abdominal infection because the doctor that operated on them across the border is gone, missing, doesn't respond to phone calls, and they walked in this building because they know we have a lot of cosmetic surgeons in this building, and they need help. So for those who are adventuresome, who tend to worry less, it's probably okay. Pick your country, pick your doctor well. The more advanced countries, I think, offer you a little more sophistication and safety. Again, you can ask the same questions, by the way. The questions that I suggest people ask about board certification, because, by the way, there are many board-certified specialists, or I should say board-certified by American boards, practicing in other countries. That is the worldwide standard of excellence, by the way. American board certification is it. And many doctors come here from other countries to study and to pass the boards so that they can go home and say, I am a American board certified specialist. So there are running good practices outside the United States.